Hi, Jennifer Reeves, stroke coordinator. I'm going to go over a few things today, just kind of reminders for survey coming up. One of the big things is remember that TPA and TNK are essentially the same thing. So we need to be doing all of our mend and vital signs the same with either one of those. All of our nursing considerations are the same as well. The one thing that we aren't doing currently that we need to make sure we are doing is make sure we're doing Angioedema Assessment. This is on your lytic flow sheet. Your lytic flow sheet has men, dysphagia screened, NIH, pulse checks, site checks, everything on one sheet to make it a little bit easier. You do not have to do the angioedema assessment every Q15, Q30, just every couple hours, make sure you're coming in, and this will be a yes/no checkbox. The other thing is make sure that when we are documenting our daily education, that we're doing what is specific to the patient. So a lot of times what I see is this top box checked, which pre-checks every single thing. So it looks like the patient has a hemorrhagic, ischemic, and a subarachnoid hemorrhage, and it checks every risk factor from AFib to lupus to sickle cell and everything in between. So one of the big things that Joint Commission will be looking for when they convert a survey is making sure that we're only clicking what is specific to our patient, okay? The other thing is to make sure, just a quick reminder, what I'm seeing on SCDs is the patient refuses. So understand that if your patient refuses SCDs, then you have to call the doctor and get an order for Lovenox or heparin, unless they're on an anticoagulant already, meaning Coumadin, Eliquis, Xarelto, one of those. And just because your patient is going to the bathroom, that does not make them ambulatory where they don't need the SCDs, okay? One other thing you've probably already noticed that's popped up in your health stream is there's a new dysphagia screen that will be going live July 1st. So this screen is a nationally evidence-based screen, and it looks more at our structural deficits. So the first question asks if the GCS is less than 15. Then it asks if there's spatial asymmetry, which is the same as spatial droop. It also looks at tongue deviation as well as palatal asymmetry or weakness. If any of those are yes, it's going to automatically pop a box where you order NPO and a speech therapy consult. So it will not even let you give them water if any of those are yes. And then if you go through and everything's no and you're able to give the 3 ounces of water and they do great, then you'll get the option, it'll pop a box where you can order either a cardiac or a diabetic diet. Any questions?
All right. Thank you.
Thank you.